Okay, we're up to component 2, but let's just review for a second. We went through, you recall how complicated the pathophysiology is. There were a lot of things up there on those slides, and obviously you're not going to get the quiz later. I think we get the questions. But there's a lot of, it's a complicated condition. If you think back, I remember, I don't know how many years ago, probably 30, 40 years ago, it was thought it was all psychological. And if you're wheezing, you had a psychological condition. And now you can see from what Dr. Jacobson just showed, it's really an allergic bronchitis. Using the guidelines to organize our attack against it, we had that component 1 on what to do with your doctor visits. Now we have what to do to control the factors that contribute to the severity of the asthma. And I'll go through each one. I'll go through them quickly, and I'll give you my viewpoint. First of all, can you control respiratory irritants? Tobacco is pretty much banned from buildings for the most part. Nevertheless, we get our tobacco exposures. Fragrance is not banned, and that's something that we all have to deal with. That can certainly be a strong trigger. Fresh paint can always be a problem depending on where you're going. And I put etc. for all the other irritants, cleaning chemicals. As a nurse I treat from the Veterans Administration Hospital up in Riviera Beach, and for some reason they are always on the day shift, which is when she works. They're painting, cleaning, it just never stops, and she ends up in the emergency room. Of course, they want a nice, clean Veterans Administration Hospital. I guess that's why they're doing it. Next up, can you control your allergen exposure? We'll go through some common allergens in a few seconds, so I won't go into details with that. Allergen detection. How does the doctor decide what's a relevant allergen? Well, first of all, seasonal history is almost meaningless here in South Florida. I think all the allergens, to a variable extent, are present throughout the year. And it's not like I trained in Ohio. We knew if we were seeing people in June, it would be grass pollen. If we saw people when the heat came on, it would be the dust mites. Here, there's none of the above. Skin tests remain a very useful way. You have that same IgE and those mast cells that we saw in the diagram. They're in the skin, so you could expose the skin to the substance, get a little welt, and there you go with, you're probably sensitive if you breathe it in. There's a blood test called a RAS test. There are brand names among blood tests, just like there's differences among automobiles where maybe a Lexus is different than a Hyundai. There's differences within the blood test for detecting what allergen you might have. We just started here at the hospital using a specific brand called an immunocap test, which seems to be superior to the previously used tests. They bought some new equipment, and that will help distinguish, are you allergic, what are you allergic to? Skin tests versus blood tests, it depends on the individual case. Skin tests are cheaper, usually better to go the cheaper way. Beta blocker drugs. Beta blocker drugs can be used for glaucoma. They can be used for stage fright. They can be used for migraine headache prevention. They can be used to straighten out your heartbeat if you have too much of an adrenaline surge. They even use them in heart failure. They will also aggravate asthma. There's a doctor in University of South Florida. His name's Andor Sventavani, and he's a PhD in pharmacology. What Dr.